Okay, so this is the door of the resident workroom. I'm gonna put the code in. Here is the resident workroom. Notice how everybody is pretending to work. This is the assistant program director.
Hello, good to see you all. Just doing a little weekend call here.
That's right. And then we've got John, our lovely senior resident on the service. Margaret, our lovely new intern on the service. Hallway outside our office with the wall of shame, I mean fame, all of our prior years of holiday photos, where it's really fun to look back at all of our attendings when they were younger and had more hair, at least the male attendings. Here is the office, admin office, and we have lovely administrative helpers that can help you to coordinate research meetings, who also coordinate our OR schedules and clinic schedules and conferences. And here's our office. Oh, hello.
Hi.
It's Catherine.
Yeah.
Her second week, full week of fellowship. How's it going thus far?
It's going great. Yeah, it's good. Been able to get in the OR, which is always fun. So.
Yeah, she did periaortic nodes and a ileostomy reversal on her first week.
Yeah, it was awesome.
And here's our office. We have our white coats. We have our message board. We have our mini fridge. We have our decor, snack drawer, an espresso. So this is the clinic hallway here. We have a number of exam rooms, clinic spaces with, of course, computers and a sink to wash your hands, and all the materials you would need to do pelvic exams as needed. It's very nice and bright and airy, with lots of artwork. Down here is the office where one of our lovely physician's assistants works. Would you like to introduce yourself?
Hi, you can't see me, but I'm Joanne. I'm one of the PAs here. I share the office with Melanie Schmuel, the nurse practitioner, and there's two of us here that are primarily clinic based, and so this is our little abode.
Oasis.
And yeah, so when you're here, pop in. There's a jump seat here in case someone wants to chit chat or talk. So we'd be lovely to see you and welcome you to clinic.
Awesome. Here's our clinic space. We have physician workspaces with a window. And oh, here's another one of our lovely faces of the team.
Hi, I'm Megan Peterson. I'm one of the nurse practitioners. I work in clinic half the time and up inpatient half the time, where I'll get to hang out with you a lot.
Hello.
Hello.
Here's one of our lovely nurses that works in clinic.
Hello, my name's Kelly. I work here in clinic, been here 25 years.
She's fantastic. She will help you do your job better. So know her and be nice to her. And here's more of our hallway in clinic. Our lovely
Everyone gets to know Sandra.
scheduler, Sandra, doing her job diligently. And here's one of the conference rooms where we do a lot of our patient care discussions. We are able to show them imaging from their CT scans, etc., and come up with a plan of care.
Hi everyone, Ryan Spencer. Again, I just wanted to show you our chemotherapy infusion area. So this is a centralized nursing station for chemo infusion. And then what you'll see, patients who are having a new start of chemotherapy get one of these bays. You've got the stretcher, the monitors, they get a nice window view here. And then in subsequent chemos later on, you end up with these smaller bays here. As we figured out, you're less likely to have reactions. The fellows end up spending a little bit of time up here. Sometimes people are getting ports put in for chemotherapy. They'll get those done, they'll come up here, you evaluate them for chemotherapy on that day that they're in clinic. Sometimes you'll come up here if there are reactions, you gotta come see people. So it's a nice place to have a handle on. It's good to know the nurses up here. You get a lot of good interaction. The pharmacists are up here as well. There's a whole pharmacy substation up here that mixes chemotherapy and also can dispense outpatient prescriptions for people who are leaving chemotherapy that day. They just have to get medicines there. They don't have to bother going to their pharmacy after they're done. Hey everyone, Ryan Spencer, Associate Program Director. Just going to show you a little of the pre-op area, PACU, OR, so let's go in and take a look. These are all our pre-op bays. This has been here for maybe just a few years now. Everyone who's coming for a surgery where they're staying overnight ends up being here. You can come and see them in the morning. We have ability to give blocks, so epidurals, tap blocks, QL blocks, prior to surgery right in these rooms, so everything happens here before surgery. Come with me, I'll show you the PACU area. One of the great things is it's right across the hall from the pre-op area, so you can take a patient in and you just hop right across the hall to see the next patient for surgery. And every patient who finishes their surgery in the ORs comes right over to these PACUs, so it's all a centralized location. Now from this spot, you got PACU right behind us, pre-op just down the hall, and the ORs are right through this door here. Central control desk for the ORs is right over here, and then down these hallways, there's all the different ORs. Let's get a hat on, show you what those look like. We'd have 2 robot consoles here at UW for robot surgery.
Never a problem to book a robot case as needed.
And take a look at one of the basic ORs here. Looks like many other ORs. UW has 28 operating rooms just for the adult portion of the hospital. There are 12 outpatient operating rooms in addition to that, and then Children's Hospital has its own operating rooms as well. And the last place in the OR that we'll show you, and perhaps the most important, is the surgeon lounge, where you can get free hot cocoa or coffee or other things. But you'll find a lot of the staff hangs out there, so it's not just for surgeons, it's actually an interdisciplinary collaborative space. So nursing staff is there, our scrub techs are there, the MAs in the OR are there. So it's a nice place to go in, and I often find myself after a case, if I don't have another one, I stop in there, see who's there, strike up a conversation, hang out for a little bit. We end up being pretty close to most of the people we work with. So there is a specific team of scrub techs and nursing staff that we do our cases with, so you get to know them pretty well, actually. And you can access those in a couple different locations, but here, let's just give you a look. Locker rooms are down the hallway here, and right across you've got the collaborative space. And one of my favorite people is here. This is a great place.
What are you doing?
It's so good to see you. We're showing our candidates the operating room because we've got to do it virtually this year. So you can
And
see
there's
we've got
donuts on
vending
Saturday.
machines. There's coffee,
man.
tea, water over there, space to be, and oftentimes you'll find food here just hanging out for anyone to have. So that's our OR.
Maybe you'll ride your bike to work along the Capitol, along State Street, which is a pedestrian and bike bus road only at all times. Here's the main entrance of the hospital. And if you don't want to ride your bike every day, you'll have a parking pass to park here, which which is just a short distance from the hospital. Here we are, standing just west of the Memorial Terrace, Union Terrace. And this is Lake Mendota, a lone fisherman. There are docks over there that usually are full of boats that you can take out as part of the sailing club. And this is a running trail, part of it, that goes along the lake over to that spit of land sticking out called Picnic Point. It's a great run that you can do even while you're on call, because you're only within a couple of miles of the hospital.